Cedar turns out to be a really, really mean allergen, and I mean by mean allergen is it has a tendency to cause a lot of reactivity, even for people who don't typically have allergies. Generally in kids, for seasonal allergies like cedar allergy, we tend to see them around the second year of life, because with most allergies you have to have a sensitizing phase. So in other words, the first time your body sees an allergen is whenever the immune system develops a response, and then the next season that it sees it is whenever you actually get most of your symptoms. Part of the problem that makes it difficult is cedar is hitting right at the same time as most of the colds and flus and all the other things that are going on, and so it can be really difficult to tease out what is driving symptoms, because the nose reacts very similar to all kinds of things it doesn't like. So colds cause runny nose, congestion, sneezing. The same with cedar, it will cause runny nose, congestion, sneezing. Parents should come to us whenever they suspect a seasonal allergen that's driving it. So a constant runny nose. Sometimes they'll notice kids that will have a little crease on the top of their nose. That's from constantly rubbing their nose. We call it the allergic salute that's there. The dark circles in the eyes, we call it allergic shiners. And whenever you're seeing those sorts of things, recurring ear infections, recurring sinus infections, all those can be signs that you have allergies that are in the mix. What we do for allergy testing is we scratch the skin with extracts that are the same extracts or the same material of what you would be allergic to. And if you get a little bump that looks like a mosquito bite, then we know that you are allergic to that. It is not like drawing blood, but in the same token, it does, because you're scratching the skin, it is a little bit uncomfortable for that. The worst part of skin testing is just not being able to scratch the itchy spot that you get on your back or on your arm from the allergy testing. And then we look at that, we look to see what things you may be allergic to, what things you may not be allergic to, and then talk about what strategies we can do to help avoid or to help treat the allergens that are being present. With all the antihistamines, if you look on the back of them, you'll see that they're not generally recommended for those kids that are under the age of 5 or 6, and that is because, again, it's difficult to tease out what is allergy and what is a cold. So if you're giving antihistamines for colds, it's not going to be helpful, and if you are not dosing them properly, then it potentially could be harmful. So that's why in general, if it's on the age of 6, we need to check with a physician before you move on. If it is allergy and you've kind of got the green light from a physician, then most over-the-counter antihistamines are very safe, and they're effective at really getting rid of the itchy and sneezy symptoms that are there. The most effective medicines by far for nasal symptoms for allergies are nasal steroid sprays, which do an excellent job at getting rid of symptoms, and those are prescription.